Dr. VanDyke here. Want to talk about some myths and debunking some stories and things that you might hear on the internet about thyroid nodules. I'm a board certified endocrinologist, and it's important that we are getting accurate information and not something that some random person made up somewhere and is broadcasting it far and wide. So, thyroid nodules, first of all, this is very common. I hear this, that you cannot shrink thyroid nodules by giving thyroid hormone. It used to be thought that that was the case, but it's just not. Okay, it's not substantiated by any evidence anywhere. If you go giving thyroid hormone to people that don't need it, what are you doing? You're putting them at risk of heart arrhythmias. You're putting them at risk of thinning of the bones and kind of erosion of some muscle mass over time. It's not a good idea to be giving thyroid hormone to people who do not have hypothyroidism. Another thing that I hear a lot about is, well, if I have a thyroid problem, nodule or functional otherwise, I need to take thyroid support supplements. And generally speaking, we want to get away from that stuff. If you were to go to a vitamin shop and find a thyroid supplement, a thyroid support supplement, and you read the ingredients there, a lot of the time, these ingredients contain dried out, ground up animal glands. They might contain pituitary gland. Pituitary is what makes TSH, or thyroid stimulating hormone. Or they might contain bits of thyroid gland itself. And then what are we testing? Are we testing you, or are we testing the animal that's in the supplement? So this is not recommended by any endocrine society anywhere in the world. Another thing that I see a lot of are internet stories, or even some practitioners who are saying, listen, you need to take a bunch of iodine. Here, take these iodine drops. And generally, in the United States, people who eat the United States diet, especially if they specifically use iodized table salt, you do not need extra iodine. And if you go loading the thyroid with iodine that it doesn't need, you can either kind of trigger it to become hyperthyroid, which can be a temporary problem, or you could do the opposite. You can kind of block it and it won't do anything. So there are roles for iodine drops to play, and those are very, very specific and typically quite emergent hyperthyroid problems. And those are the only situations that we should be using that. And, thyroid nodules, again, they're very common. So you might hear lots and lots of stories about this stuff. And it's always good that you check with, ideally, an endocrinologist, right? But at least your primary doctor, if you hear a thing that you think maybe you should do for your thyroid.